Welcome to our channel, where we bring you essential health information in an easy-to-understand format. Today, we're diving into myelodysplastic syndromes, commonly referred to as MDS. MDS is a group of diverse bone marrow disorders that result in ineffective blood cell production. The condition occurs when the bone marrow fails to produce enough healthy blood cells, leading to various complications. Now, let's talk about how MDS develops. It often starts in the bone marrow, where blood cells are produced. In MDS, the bone marrow produces immature cells that fail to develop into fully functional blood cells. This can lead to a shortage of red blood cells, white blood cells, and platelets. The exact cause is often unknown, but various factors can contribute, such as exposure to certain chemicals, previous chemotherapy, radiation, or genetic mutations. MDS can occur in anyone but is more prevalent in older adults. Symptoms of MDS can be quite vague and may develop gradually. Patients might experience fatigue due to anemia, shortness of breath, increased susceptibility to infections, or unusual bleeding and bruising. Given how these symptoms can mimic other conditions, MDS is sometimes overlooked. Diagnosing MDS involves a combination of blood tests and bone marrow examinations. A complete blood count, or CBC, is often the first step. If the CBC shows abnormal levels of blood cells, doctors usually recommend a bone marrow biopsy. This procedure helps to examine the bone marrow cells directly and identify any abnormal cell production. Once diagnosed, MDS can be classified into several subtypes based on the characteristics of the blood cells and the percentage of blasts, which are immature cells, present in the bone marrow. The World Health Organization categorizes MDS into categories like MDS with excess blasts or MDS associated with deletion of chromosome 5, among others. These classifications help in understanding the prognosis and determining treatment options. Speaking of treatment, MDS management varies significantly depending on the severity of the disease, the number of abnormal cells, and the patient's overall health. For some individuals, especially those with mild forms of MDS, close monitoring may be all that's required. For others, treatment options can include medications, such as growth factors to stimulate blood cell production or immunosuppressive therapies. In cases where MDS progresses to a more severe state, treatment options may include chemotherapy or even stem cell transplantation, which can potentially cure the syndrome by replacing the defective bone marrow with healthy cells from a donor. It's crucial to involve a hematologist who specializes in blood disorders, as they can provide tailored treatment plans based on the specific subtype of MDS. Living with MDS can be challenging, and it's important for patients to engage in supportive care. This may include nutritional support, lifestyle changes to minimize infection risks, and emotional support through counseling or support groups. Staying informed and connected with healthcare providers is essential. In summary, myelodysplastic syndromes are complex disorders with varied presentations and treatment options. Early diagnosis and tailored management plans can significantly improve quality of life and outcomes for those affected. If you or someone you know is experiencing persistent symptoms that could align with MDS, don't hesitate to consult your healthcare provider for further evaluation. Thank you for tuning in to learn about myelodysplastic syndromes. We hope this information helps shed some light on this important topic. If you found this video informative, please like and subscribe for more health-related content. Until next time, take care and stay healthy.